Percutaneous laser discus decompression, in short PLDD, is an effective hypothermal minimal invasive treatment for contained disc herniations. The precise application of the laser energy into the nucleus pulposus of a discus reduces intradiscal pressure, leading to a reduction of nerve root compression. The laser heat also achieves a thermal destruction of intradiscal nociceptors, which are often responsible for a discogenic pain syndrome.
The results after microdiscectomy in patients suffering from sciatica due to small contained discus herniations are not satisfying. The recurrence of sciatica is nearly 40% and the reherniation rate is 13%. Also, complications like secondary bleeding, infections, peridural scar tissue formation, iatrogenic microinstability, dural sac tear, and revision surgeries are common. The indications for PLDD are contained disc herniations with consecutive foraminal stenosis causing sciatica in patients with failure of conservative treatment. Also, patients with low back pain originating from a damaged vertebral disc, especially a ruptured annulus fibrosus, benefit because of a thermal ablation of the ingrowing nerves into the nucleus pulposus. The post-nucleotomy syndromes are also very treatable. The nucleotomy at the lumbar spine is carried out with an 18G needle under fluoroscopic guidance after local anesthesia. The right position of the tip is the dorsal 1/3 of the discus.
It is important to maintain a parallel alignment of the needle between the vertebral bodies. The right position should be controlled in AP and lateral view.
A discography with contrast medium leads to further information about the condition of the discus. A memory pain test, which is a provocative test because of an intradiscal pressure increase, is also a good diagnostic tool and is routinely performed before treatment. After the correct needle replacement, the glass fiber is inserted. The fiber overlaps the tip of the needle by 2 mm. After adjustments, the laser is started in pulse mode. For the cervical spine, I use a 20G needle and an anterolateral approach.
The advantage of PLDD is the minimal invasivity and the avoidance of significant soft tissue injuries. No serious complications are described, especially no risk of peridural fibrosis or scarring. PLDD is an outpatient treatment. It is performed under local anesthesia or mild analgesic sedation. Patients have a minimal recovery time compared to microdiscectomy, and the costs are much lower.
PLDD is a hypothermal, minimally invasive treatment with no serious complications. PLDD is easy to perform, has a high success rate and a quick effect, needs no long-term rehabilitation, and is repeatable if necessary.
People come up with the best ideas in the middle of the incredibly beautiful natural surroundings of the Black Forest. And people who want to achieve success have to think ahead while focusing on the goal they want to reach. There is no margin for error, and they always have to keep their eye on the ball. What is it that makes a difference in modern medical technology? We try to answer this question every day. We face challenges due to complex structures in the bedrock of our industry, and the fact that we operate in the field of neurosurgery. This determines our way of thinking and the actions we take. Finding talent and developing it is part of our corporate culture, which is geared towards research and innovation. Our state-of-the-art production facilities and in-house cleanroom production operations are the prerequisites for achieving the highest quality products. The best solutions are discovered in teams with flat hierarchies and by having fun while working towards success.
Intraoperatives Neuromonitoring ist essentiell. Erst durch die Verschmelzung differenzierter Bildgebung und der funktionellen Überwachung der Patienten bei der Operation erzielen wir gute Ergebnisse. Das macht unsere Ergebnisse dann sicherer. Zum Zweiten ist es so, dass wir manche Operationen ohne Monitoring nicht durchführen können. Ein gutes Neuromonitoring-System, so wichtig wie es ist, muss sich in eine komplexe Arbeitswelt, ein OP, integrieren. Und deshalb muss es intuitiv, sicher und zeiteffizient handhabbar sein. Die Zusammenarbeit mit Dr. Langer Medical macht Spaß. Sie macht deshalb Spaß, weil die Partner auf der anderen Seite vom klinischen Alltag wissen und von unseren Problemen und weil wir uns sehr, sehr gut über diese Probleme und Lösungen austauschen können. Das Team ist hoch motiviert und hoch professionell.
Technology has to be fun while still remaining functional. And when customers sense this, it is the best way of confirming to our team that they got it right.